Welcome to the course, PrEP Primary Care. This is a quality improvement project which aims to equip providers with the knowledge and tools to aid in prescribing PrEP to eligible individuals. Data from the newly released HIV surveillance report in 2020 showed that despite the declining trend of HIV infection in a national level, disparities continue to exist. Racial and ethnic differences in new HIV diagnosis persist, and people aged 30 to 34 were accounted for more than half in 2020. Racism, HIV stigma, homophobia, poverty, and barriers to healthcare continue to drive these disparities. PrEP, or pre-exposure prophylaxis, is safe and effective biomedical prevention against HIV, remain underutilized, and its adoption also vary across racial and ethnic lines. The hope of this project is for every provider to continue to care and protect the most vulnerable population against HIV, because we are all in this together. The objectives of the course are the following: to understand pharmacodynamics of medicines used for PrEP to prevent HIV, identify the indications and PrEP fundamental types, enumerate population at risk for HIV, utilize risk assessment and PrEP eligibility tools, familiarize with PrEP clinical guidelines, acquaint to sexual health history taking strategies, and locate resources for PrEP adoption. Let us define PrEP. It is the use of antiretroviral medication to prevent HIV infection. By this time, there shall be no argument that it is safe and effective. FDA has approved it and received Grade A recommendation from United States Prevention Services Task Force. It is part of a combination prevention strategy that you can see in the table at the right side. Next slide will allow us to have a visual presentation about PrEP and how PrEP works.
People are talking about PrEP, but what is it and what does it do? PrEP means pre-exposure prophylaxis, and it's the use of medication to help keep someone who does not have HIV from getting infected with it. This is important because HIV continues to be a worldwide health crisis. In the US alone, there's an estimated 1.2 million people living with HIV, and many of them do not know they're infected. About 50,000 people become infected with HIV in the US every year. There are lots of ways to stay safe from HIV, and using condoms has been the main strategy for years. PrEP, though, is a new HIV prevention strategy that's recently been approved by the US Food and Drug Administration, also known as the FDA. In order to approve PrEP for use in the US, the FDA looked at results from several research studies that found PrEP was safe to use and effective at preventing HIV infection. People in the studies who took PrEP every day reduced their risk of getting HIV by as much as 99%. However, people who did not take PrEP every day were not as highly protected, and people who didn't take PrEP at all got no protection. So, how does it work? Let's take a look at how PrEP helps prevent HIV infection in your body. Your body is protected by special cells in your immune system called CD4 T cells. These cells normally help keep you healthy when you're exposed to a germ or virus. But when HIV enters your body, it hunts down these T cells, attacks them, and uses them to make copies of itself at a very high rate, as many as several billion copies per day. These new copies of the virus go out into the body and hunt for even more T cells to take over, using them to make even more copies. The immune system just can't keep up with the virus to stop it from making all those copies. And that results in HIV infection. Now, let's rewind and see what would happen inside your body if you were exposed to HIV while taking PrEP. Imagine that you start taking PrEP once a day. Your body digests the pills, and the medication starts building up protection for your T cells. After taking a pill each day for about a week, your T cells are getting maximum protection. Then you are exposed to HIV. As before, HIV tries to attack your T cells, but this time, because you've been taking PrEP, it doesn't succeed. It tries to get into the cells to make copies of itself, but it can't because the cells are protected. The result? No HIV infection. How should you take PrEP? PrEP comes as a pill that you should take once every day, and it takes about a week to build up the maximum level of protection. But because PrEP is a medication that gets used up by your body, if you don't continue to take it every day, your cells will lose that protection. You control how much benefit you get from PrEP, and that ranges from no protection at all to very high levels of protection. PrEP works best only when you take it regularly, once each day. Taking extra pills will not provide you with extra protection, and it could even make you sick. One pill a day is the key to PrEP. What else do you need to know about PrEP? PrEP has been shown to be safe and effective in preventing HIV infection when taken regularly. But as with all medications, there are some things you need to know. PrEP is not a cure for HIV. PrEP is not a vaccine against HIV. PrEP is not a morning after pill. It will not prevent infection if only taken right before or right after exposure to HIV. Remember, the medication needs time to protect your T cells. Even taking PrEP every day will not protect you from other STDs like herpes, gonorrhea, and syphilis. PrEP does not prevent pregnancy. Some people may experience an upset stomach when first taking PrEP until the body gets used to it. PrEP should only be used if you're HIV negative. HIV positive people need full treatment, not PrEP. If someone is already infected with HIV, they need more than just one medication to control the virus. That's why anyone starting PrEP must first get an HIV test to make sure they don't already have an infection. And they need to get tested regularly for as long as they're taking the medication. And if they've taken a break from PrEP, they must get tested before starting it up again. PrEP is safe, and it works very well, but it needs to be taken regularly. If you choose to take PrEP, remember how it protects your T cells from HIV. And be sure to take it once a day, every day, to take control of your sexual health. Where can you find out more about PrEP? In addition to this video, you can find links and other resources online at whatisprep.org.
In the United States, there are 3 PrEP drug regimens available. In 2012, Truvada, with generic name disoproxil fumarate, and M3-citabine tenofovir were approved to prevent HIV among at-risk women and men through sex and for those persons who inject drugs. 7 years after, Descovy was the second approved PrEP in 2019. This is particularly indicated for men and transgender women. It is not, however, recommended for women and other persons at risk through receptive vaginal sex. This is not due to safety reasons, rather because of lack of clinical studies in such population. Finally, Apretude or cabotegravir was approved as the first injectable PrEP last December 2021. This is the first extended-release injectable suspension for individuals who engage in at-risk sexual behaviors. Because it has not been studied for persons aged less than 18, it is therefore not recommended in that age group. Now, let us discuss on how PrEP medications are taken, or the PrEP fundamental types. The first type is oral daily PrEP. Here, Truvada or Descovy is being taken daily at the same time each day. The second type is oral on-demand, or also known as 2-1-1 oral PrEP. Here, 2 Truvada pills are being taken 2 to 24 hours before sex. 1 pill 24 hours after the 2 pills, and another pill 24 hours after the 3rd pill. This is an off-label prescription, although several studies already supported that it is effective. Please also note that this is only for the MSM population. According to a recent study published in Clinical Infectious Diseases, a study followed 279 male patients who used PrEP on demand for a total of 3 months, After a year of follow-up, there were no new cases of HIV transmission from any patients who used 2-1-1 regimen. Receptive vaginal sex won't be protected by 2-1-1 regimen and should opt to daily regimen. Additionally, PrEP 2-1-1 is not recommended for people with chronic hepatitis B or those who are on hormone replacement therapy taking testosterone or estradiol. The third fundamental type is injection PrEP. Apretude is being given intramuscular injection every 8 weeks, and the study found that it is superior compared to Truvada. We shall also discuss with our patients PrEP usual side effects. For oral PrEP, Truvada and Descovy, nausea, diarrhea, or headache, usually mild and resolves within a month. Renal dysfunction, on the other hand, typically reversible if PrEP is stopped, and this is greater with Truvada. Slight loss of bone mineral density over a year of use, and there is actually no increased risk of fracture. Again, the risk would be greater with Truvada than Descovy. For Descovy, there is a possible weight gain, and for injection PrEP or Apretude, injection site reaction, possible slight fever and rash, and this would usually fade away. For PrEP drug-to-drug interactions, you can check your PrEP primary care toolkit for the table, or there is an online resource www.hiv-druginteractions.org/checker. According to literature, one of the barriers to PrEP adoption includes misconceptions on who can take PrEP. So let us try to answer who can take PrEP. Adolescents and adults who are HIV negative, those who weigh at least 77 pounds or 35 kilograms, or those who are at risk for getting HIV from sex or injection drug use. CDC further streamlined the indications for PrEP. It says there to prescribe PrEP to anyone who asks for it, including sexually active who denies any risk factors. Furthermore, PrEP is recommended for anyone with condomless vaginal or anal sex with a partner of unknown HIV status, HIV positive sex partner, a recent bacterial sexually transmitted illness, injection drug use with sharing of needles or equipment, any survival or transactional sex, desire to conceive with a partner who is HIV positive. Committed to safeguard the health of every member of the society, especially those who are vulnerable and the minority groups, primary care providers shall, in particular, reach out to the following population, discuss PrEP as part of the combination strategy to prevent HIV. The following are vulnerable population who needs PrEP, men who have sex with men, transgender women, adolescents, persons who inject drugs, sex workers, and people in prison. To assist us in PrEP adoption, here are PrEP clinical guidelines. First is to determine HIV status. HIV test within 1 week before starting PrEP, ideally HIV antigen and antibodies. HIV RNA is being done if possibly infected within the past 2 to 4 weeks. Sexual health history taking has been identified as a barrier in discussing PrEP according to literature. In your PrEP primary care toolkit, included in this course, are strategies on how to discuss sexual health and practices. Also included are the different risk assessment tools that will guide you in your practice to identify those who are at risk and eligible for PrEP. For laboratory, oral PrEP, we check for creatinine for estimated creatinine clearance, hepatitis B panel, cholesterol, and triglycerides. Sexually transmitted illness testing would include gonorrhea and chlamydia. The sites would possibly include throat, rectum, genital, or urine screening according to the sites of exposure. Syphilis, hepatitis C, antibodies. Consider also hepatitis A, IgG. The patient is deemed eligible for PrEP if all are met. HIV test that is negative. weight of at least 77 pounds or 35 kilograms. For oral PrEP, creatinine clearance of more than 60 ml per minute. Please note that in injection PrEP, creatinine clearance is not necessary or required. Reports with or without substantial risk. Once deemed eligible, we discuss PrEP fundamental types. Oral, that could either be daily or 211 or by demand PrEP, and the injection type. We guide patient in making the best decision for himself or herself. Allowed to sign an informed consent. In your PrEP primary care toolkit, you can find an example of an informed consent. Although this is not necessary, it is a tool to overcome hesitancy of prescribers in PrEP adoption. Also included in the toolkit are provider checklists for PrEP, initial visit, and follow-up visits. As we initiate PrEP adoption, it is critical that we discuss the following. Provide more information on PrEP and its potential side effects. Emphasize the importance of adherence. Explain the follow-up schedule, and do risk reduction counseling such as safer injection drug use practices. Explore reproductive goals or contraception. Provide condoms and lubricants if available. Differentiate pre-exposure prophylaxis and post-exposure prophylaxis. And inform that PrEP does not protect them from other sexually transmitted illnesses. For patients who are on oral PrEP, follow-up visits are done every 3 months. Every 3 months, we check whether the patient remained to be HIV negative. So we check HIV antigen antibodies as well as HIV RNA. STI testing would include gonorrhea, chlamydia, syphilis, hepatitis C, and we consider hepatitis A. We also check pregnancy tests if applicable. Every 6 months, on the other hand, creatinine clearance for persons aged 50 and above, or estimated creatinine clearance for less than 90. Every 12 months or annually, lipid panel, hepatitis C virus antibodies for MSM, transgender women, and people who inject drugs. On the other hand, for patients who are on injection PrEP, follow-up visits are done every 2 months. We need to determine HIV status, whether they remain HIV negative. Hence, we order for HIV antigen and antibody as well as HIV RNA. We assess for signs and symptoms of acute HIV infection and do risk reduction management, again, like needle exchange program. And then we administer Apretude. Every 4 months, on the other hand, we check for bacterial STI testing for MSM population as well as transgender women who have sex with men. Every 6 months, we also check bacterial STI testing for all heterosexually active people. In prescribing oral daily PrEP, that could either be Truvada or Descovy, here would be the example. Please note that 2 refills for a total supply of not more than 90 days for both. And please note as well that in Descovy, it is not recommended as PrEP for those at risk from receptive vaginal sex. And for those patients who are on oral on-demand or 211 oral PrEP, please note that this is an alternative for MSM population who have sex infrequently. We prescribe Truvada, 30 pills with 0 refills, and HIV test is necessary before refill. We instruct them to take 2 tabs orally, taken 2 to 24 hours prior to having sex, and then 1 tab orally 24 hours after the first 2 tabs, and then another tab orally 48 hours after the 2 tabs taken. Also, we instruct to continue 1 tab oral daily until 48 hours after the last sexual encounter. For those who are interested in injection PrEP, we prescribe gabotegravir or Apretude 600 mg IM um, to be injected at gluteal muscle. Initial dose will be done, and the second dose would be a month after the first dose, and then every 2 months thereafter. An option would be 30 mg of gabotegravir oral daily for 30 days as an oral lead-in before the first injection. If the patient is already thinking or planning to stop the daily PrEP, we need to instruct them to continue for 28 days after the last potential HIV exposure. On the other hand, if a potential high-risk HIV exposure occurs while they are not on PrEP, we need to start them on post-exposure prophylaxis within 72 hours for 28 days, then restart PrEP if still HIV antigen antibodies are negative. As we conclude this course, the PrEP Primary Care Toolkit is a good resource in PrEP adoption. It also includes reimbursement codes, patient and provider frequently asked questions, drug information on Truvada, Descovy, and Apretude, other PrEP resources, and the CDC pathway of paying PrEP. Thank you so much for participating in this course.